Well, it looks like we're live, everybody. Thanks. This is our first live stream for the Chris Wolfe podcast on iCode Media. Hello and welcome. It's super excited to do this. I was kind of playing around with ideas about how to bring you new content in a live fashion so that we could engage with some of our people, but also to just test this because I think we're going to do this over time, and we're going to use this to interview some other people over time as well so that we can have some call-ins. And so today what I wanted to do, first of all, was to talk about myopia management and calculators. And, as always, we always do talk about, supporting our sponsors. But before we get into that, because this is a live stream, I wanted to just talk a little bit about our sponsors. Just to give you a little background, we started this podcast in 2019. And so we did it for a full year before any sponsors had reached out to us and wanted to come on board and help support the podcast. So we were committed on a weekly basis. And then CooperVision, Ron John with CooperVision actually reached out and said, "Hey, Chris, do you have any sponsors for the podcast? We love what you're doing and we'd love to be able to support it." And so we brought them in and they've been with us since the very beginning. And then fast forward about a year. Now I think the other thing that's really important is for me to say that these are products that we use in our practice. So we've used CooperVision products for our patients for a number of years. We believe in their products. We believe in the quality of their products, as well as the price point for our patients and for our practice. That was a really big thing for us. It was mainly the quality, but then the subsequent price point for our practice. And then we fast forward a year, and to give you a little background on my history with MacuHealth, when I did the AMD protocol for Vision Source back in 2018, when I developed that AMD protocol, within Vision Source, what they do is they let me and my team within Vision Source, Aaron is a big part of that team as well, develop the protocols from the ground up. We look at the evidence, we kind of build those protocols, and then we say, all right, we need to be able to ship this around the country and deliver that content around the country. So we've done myopia management, diabetes, AMD, dry eye, and glaucoma. And in order to do that, we reach out to vendor partners. And that's where I really encountered MacuHealth for the first time. And it's important to know that when we develop those protocols, the back end, when this team is developing those protocols, we do not work with vendors while we're developing them. We just scour the literature and say, what should we be doing for each one of these clinical scenarios for patients who have those clinical disease states, and how we should be managing them. And then we say, okay, well, here's what the protocol is going to say, vendor. What do you think? Is this something that you would be able to support? And that's when I first encountered MacuHealth, is after we had developed that AMD protocol. And so we started using them in our practice, and we have a lot of great results with patients. And then they reached out to me after about a year after we took on Cooper as a sponsor, and said, "Hey, we love what you're doing. We'd love to be able to support it." And Frederick has been a supporter ever since then. And then fast forward another year or so later, and Essilor Luxottica kind of realized the same thing. We've used Essilor Luxottica products in our practice since I've been in practice, basically. They're great for our patients. They're great for our practice. And they wanted to support the podcast. So that's how they came on board. So I wanted to give you a little bit of background there because this is live. I'm not doing kind of the normal ad roll, but I think it's kind of an interesting story. And these vendor partners have been with the show for a long time now, and they allow us to do what we're doing. And so today, I wanted to kind of highlight that. When we think about the value of calculators, I think it's really helpful for you to think about, what do calculators really allow us to do in clinical practice? I mean, it's obvious that a lot of times people think, if I just have this magic button and the calculator can help me articulate and convey ideas to patients and to their parents, for example, when we're dealing with myopia, that's going to be a magic bullet. But I think that's really incorrect to think about calculators in that way. First of all, within any of the disease states that I help doctors manage, with any of those disease states that we incorporate into our practice, I find that there are these inflection points that make it really helpful to understand the disease state and then articulate the disease state. And the calculators are just a piece of that. But there's no one thing that I can say, if you say this to a patient, then that's going to make a patient want to pursue myopia management. Or if I show them this, that's not the way to think about them. So I think they're really important to use. but they're imperfect. So first of all, calculators model individuals or model large patient populations for individuals in your chair. So that makes them imperfect. And you can't really know how that individual is going to fit within the calculation. That's a downside of a calculator. The other downside of using clinical calculators right away is that even when they're really well built, they take time. So if you're not used to running that calculator and showing what you're running, and we're probably going to run into that today because this live stream is going to require me to kind of flip back and forth between a few things. So this is going to be an example of probably that imperfect experience. And so obviously, like if it's with a patient and you're using a calculator, the better you can get about knowing where that calculator is, about accessing those calculators, the easier it's going to be. The other thing that I would recommend is to kind of minimize that time is if you can have a scribe. If your scribe is there inputting data into the calculator, that'll make it a lot faster. If you don't have a scribe, then making sure that calculator is up on your desktop or on the laptop or the tablet that you're using with a patient, so you can just swap over in real time and it doesn't delay what your messaging is going to be with the patient. But I also think it's really important to refine that process and refine the messaging that you're going to communicate what you're showing a patient in real time. That's where calculators can be very valuable.
My patients with macular degeneration want clear and succinct recommendations from me related to products and solutions that can benefit their long-term ocular health and vision. To do this for my patients, I need to be confident that what I'm recommending will have a benefit to them. And that's why my supplement of choice is MacuHealth. MacuHealth is specifically formulated and clinically proven to rebuild and maximize macular pigment over a lifetime. This results in enhanced visual performance and aids in the treatment and prevention of age-related macular degeneration. I've discussed carotenoid absorption on this podcast with Dr. Nolans and Stringham, and MacuHealth uses a patented process called micromicelle technology. And this technology is clinically proven to increase carotenoid concentrations at the target tissue and deliver the highest level of bioavailability studied to date. MacuHealth has been great for my patients. We really feel like we have the ability to help those patients in all categories of macular degeneration. If you're not utilizing MacuHealth for your patients, check it out for yourself by contacting your MacuHealth representative. Young and emerging presbyopes can be tricky. These patients want and need additional help at near, but they can be resistant to solutions that create even mild distance blur. The MyDay multifocal lens has been great for our presbyopic patients. It allows those patients to transition into a multifocal more easily. We've had this lens now for long enough that we've been able to see how simple transitions can be from an adaptation standpoint from lower ad designs to higher ad designs. The MyDay multifocal material is CooperVision's softest one-day hydrogel lens and features Aquaform technology combining the unique balance of high oxygen permeability with natural wettability in one material. The result is a highly breathable lens that keeps our patients' eyes looking clear, white, and healthy. So if you haven't started utilizing MyDay multifocal in your practice, I'd encourage you to reach out to your CooperVision representative to get started.
From a myopia standpoint, again, you're not going to be able to have a calculator that is going to just show you what's going on. And that calculator isn't going to just automatically make the patients understand what's going on. You're still going to have to use your words and articulate the ideas that you have. One of the things that I think is really helpful within myopia in general is you have to remove any doubts about what you're doing being the best thing for the patient. And so in starting, one of the things you've got to do is say, okay, well, what's going to compel me to think about myopia management as if I don't care about this, nobody else is going to care about it. I often think about this when I think about orthodontia or dentistry. You know, if you go to a dentist's office, there's no illusion about who cares more about your oral health and your oral hygiene. I'm not going to get into this within this episode too much, but I saw a recent article in one of our journals, and it was the headline was misleading. The conclusion of the headline was not something that you could gain from the study that it was showing, but but ultimately it was linking AMD risk to oral health. And I thought, why do optometrists need to link AMD risk with oral health? Why don't we just care so much about AMD as opposed to its correlation to oral health? And actually, you could think about it another way. The bottom line here is, I think you've got to remove all doubt of what you're doing as being the right thing. And one of those things is the grid that you might find that that will show you the incremental or increased risk every time a patient has a higher amount of myopia. So there's a grid one, if I were going to just give you kind of a one why, so like a main why behind why you might care about myopia management for your patients is, if you can keep a patient at a -4 who would have otherwise been a -6, you can reduce their risk of retinal detachments by about 60%. But if you can keep them as a -2 instead of a -4, then you can reduce their risk of retinal detachment by about 300% or 3x. So that's a really important why. Like, why would I even care about this? So the first thing is, am I doing the best thing for the patient? You got to believe that. Calculators can help with that, but they can't be the only thing that's going to help with that. I think the other thing that calculators can be used for is that they can project what you would expect to a patient. So patient and parent is sitting in your chair and you're thinking, okay, I want to show them what this could be, what this will likely be. That's really where calculators can be helpful. But then also when you see progression, that third reason is that if you are seeing progression on a patient, it can be helpful to show them maybe where they would have been had you done nothing versus where they are now because of that intervention. That can also kind of help reinforce what you're doing and showing them that, yeah, there are reasons that we do this, and even though we're still getting progression, we would have expected more progression based on that calculator. That's what can be really helpful. And so because of that, I'm gonna stop and I'm gonna share my screen, and let me pull up that calculator here. So there's a number of different calculators that that you can find. And so what I'm going to share right now is one that we developed for Vision Source for the myopia management protocol. Now, again, I think what's important is to find the calculator you like. This one is really great, and there are ways that you can use this one to track patients over time. So the first one I want to show you is that you can customize your own calculator within this. So you can see my name here. And then all this information is de-identified, so it's HIPAA compliant. However, because you can use a tracking ID within your EHR software, it will allow you to track that patient so that you can watch this patient over time. So I'm just going to copy this so I can show you what happens. And then I've just pre-selected a few things. A 9-year-old patient, undefined ethnicity. I'll show you that our calculator will modify this based on ethnicity as well. So you have an undefined or Asian or Caucasian population. And then we just select a few different interventions, but you can see here that we can use a number of different interventions based on studies. So we basically, when we built this calculator, we said, okay, what's going to be the normal progression? And then what intervention are you selecting, and how much do we expect that intervention to have an impact on myopia progression? Now, when we click next, what will occur is it will show you what is going to occur here. Now, there's a few things that will occur. First, it talks about how much refractive error progression you would expect, and then how much axial elongation you would expect with an intervention versus no intervention. So you can see that in numerical value right at the top of this page. And then we tell you exactly where we're getting that information. So we talk about how we look at progression, and then how we look at intervention. And then one of the nice parts is that we talk about kind of all the different interventions. You can print this for patients. So again, many calculators can be printed. This one we think is really helpful. You can save the assessment, and then you can do a new assessment. I'm actually going to save this assessment so I can show you what happens over time. So the really cool part about this too is that you can see what's likely to happen as the patient gets older. And then we actually allow you to see a standard deviation curve. So you can see where a patient might have been with intervention, but then you can see these standard deviation bars. So maybe a patient doesn't fall right in that range, but they're within the standard deviation of where they would have been versus where they currently are. And then we do the same thing within axial elongation. Now, I've saved this, and if I go back and do a new assessment, hopefully, if I have tracked this correctly, which I have, and I now make the patient a little bit older, we can't change their ethnicity once we've done this in this calculator. But let's say that we select their new, maybe they didn't progress at all, and we select their existing intervention, and then we click next. You'll now see what happens. So it gives you an idea of where you started versus where you are. And obviously it's going to use the same dates, but you can see where we started and then where we're trending. So we'll build a trend line. So as you can come back and check year after year, as long as you save that tracking ID, you'll be able to reutilize this piece of technology. So I wanted to share that with you just so you can see the value of a calculator in general, and then the value of this specific calculator related to articulating myopia progression. So, I know we may have some people who are live on the line, and so I'll pause there for questions. While we're waiting for any of those questions, I think there's a couple just general management tips, I would say, from a myopia management standpoint. Actually, we have some people in the chat right now. Let me look at that. Yeah, okay. So I've got Aaron's in the chat right now, and let's see if he can jump on. If he can't, that's okay. So Aaron's comment was calculators can really help patients visualize and make real concepts that may seem foreign and abstract them. I totally agree. I think it allows us to kind of see, all right, what is this, like visually see how this progression is likely to occur. So that's one thing that I did miss in my articulation as well. So if Aaron can't jump on, that's how we're going to learn live stream a little bit better. But Aaron, if you want to jump on, try, and we'll see how that works. If you can't, that's okay, because I'm going to summarize my recommendations. Or if anybody else can jump on, I'll let you into the live stream. But recommendations for myopia management. Okay, taking into account the fact that we have calculators and we can use calculators. The first thing is recognizing myopia as a disease. I think it's really important to look at myopia as a disease state, and then the refractive error of myopia as a symptom of that disease. It kind of takes a while to wrap your mind around, but if the disease is axial elongation and all the sequelae that we see with myopia and the worsening of myopia, retinal detachments, myopic maculopathy, glaucoma risk, increased risk of cataracts, those are secondary sequelae of the increased axial elongation, then you realize that the refractive error is also a symptom of the disease, which is myopia, as opposed to the main disease state. I think that's important. The other thing that's important is to try to make it as simple as possible. If you're going to start utilizing strategies to implement within myopia management, you want to make it as simple as possible. Aaron, I got you on.
Hey, I made it work.
Live, Aaron. Yeah, awesome.
I'm live. Awesome.
So this is fun. Okay, so I didn't get to stop you from jumping on, so you were able to jump on right away.
Yep, I jumped on.
So if you're inappropriate, I'm going to cut you off.
I'll mind my P's and Q's. Fantastic explanation, Chris. One question that I have, and it comes with all calculators, and so we'll talk about this one, is how you implement this in the practice in the day-to-day. So in a very sterile environment, we can talk through a simple, you saw a child and you can pull this up, but how would you envision a calculator like this and others being teed up and prepared ahead of time so that when the situation arises where you would want to and could benefit from using it are ready to go?
Super great question. I think, Aaron, in my practice, I would treat this just like I treat reviewing a visual field and reviewing an OCT. So with our calculator, it's right on my dashboard. I do have a scribe most of the time, but I would review all that information and plug it in before I walk in with a patient. So I hate looking at fields and OCT data and Optos data in front of the patient. I hate that. I hate kind of sorting through. I like to look at that either in the hallway or in my office before I walk in. I want to look at and know pretty much what's going on with the patient. So for me, the way I use it in my practice is to have it basically populated before I go in on that patient. I know what I kind of review what things look like now versus what they look like before. And then I can just pull it right up on the screen, just like I would an Optos or any other piece of data. I think that's super helpful and super important. What do you think?
Nope, I agree 100%. And I think it's important to have the web addresses saved on the different tab browsers. So part of the opening of the exam lanes in the morning involves opening the different calculators so that they're ready and pre-identifying cases that you might need. So if I've got, if I know I have a 9-year-old Johnny coming in, and last year he was a -1, the opening it, pre-populating, putting him in already, I can go back and change it if I need to. But having that ID already saved in my chart notes wherever I put it, so I can reference it back again. And that's something that either a virtual scribe could do ahead of time when they're prepping the day, or your text could do ahead of time prepping the day. It also, I think, helps us get mentally prepared for that visit, for that conversation before we even start with
The most common questions I get include, what ophthalmological codes or evaluation and management codes should I use? What ICD-10 codes do I need to bill with this CPT code? What CPT codes can be billed together and what can't? And my favorite, how do I manage a patient who has diabetes who comes in for a quote-unquote routine eye exam? These questions really highlight the confusion and uncertainty that serves as a daunting hurdle for providers, makes it more challenging for them to care for their patients and provide those patients with the best opportunity for a lifetime of ocular health and clear vision. That's why we built iCode Education, for this specific purpose. Our mission is to provide optometrists with resources to help you understand disease states, revenue cycles, and billing and coding so that you can put that on autopilot and truly care for your patients. Check out iCodeEducation.com. That's EYECODE education.com. We've developed a premier billing and coding bundle that includes all of our billing and coding resources in one place. We also have a 10% discount code just for listeners of this podcast. Enter the coupon code EYECODEMEDIA22 at checkout. We'd love to work with you. Check out iCodeEducation.com. We've been partnering with EssilorLuxottica 360 for a while now, and it helps us in 3 areas. First, they use social media campaigns to highlight products that we believe in and prescribe to our patients, and they deliver those patients back to our practice. Second, EssilorLuxottica 360 enhances our patient experience through staff training tools that help us simplify and streamline the way we communicate about our products and services. Lastly, but for my practice most importantly, it helps us make good business decisions related to our optical offerings. We will systematically and objectively analyze what our patients are purchasing and what they like, and removing products that our patients are not really using or not really drawn to. This, along with additional rebates and immediate savings, helps us continue to deliver high-quality products and services to our patients and keeps our practice resilient. Check out EssilorLuxottica 360 for yourself by visiting EssilorLuxottica360.com.
Yep, totally agree. I think having all that stuff preloaded is a good one, and then using it. Like I think that's the other thing, is that we think about these calculators and we kind of play with them a little bit. They're fun, but making sure it's part of building that in. This is kind of the next recommendation I have related to myopia management, is building it into the stuff you have to do every single time. So I'm going to be responsible for it, or my scribe is going to be responsible. Somebody's going to hold me accountable to that, so that I can't miss that step. I also think, Aaron, and while you're on, because now I kind of have this mindset of I'm going to go on this long tangential conversation with you, but I'm going to avoid it. When I think about the challenges with myopia in general, I think about start making it feel like other stuff you do in the practice. Trying not to make it super complicated so it feels different. I think that's one of the big pitfalls whenever people try to integrate myopia management into a practice, is they try to make it unique, and that will fail. I mean, there are certain things that you've got to make unique for sure, but you know how to manage diseases, you know how to manage glaucoma, you know how to manage macular degeneration, you know how to fit a contact lens. So are there other things that you do, managing glaucoma, managing macular degeneration, that this is similar to? And is it similar in fitting a contact lens, a spherical contact lens, or a multifocal contact lens? Can you make a technology like MySight as similar to that other thing that you do as possible? I think the answer is yes. And I think also, if you feel like there are services like maybe orthokeratology that require something more, some additional time and expertise, you probably need to do it away from the comprehensive exam.
Yep. No, I agree 100%. And adding on to to your idea of, doing something a little bit different, or making yourself known for something different. I'm a firm believer that everything is selling. So even in the exam lane, we're selling our recommendations, we're selling our knowledge, we're selling our expertise. It's not a used car salesman selling, but you're trying to motivate somebody to change behavior. And part of this tool that you haven't shared yet, maybe I'm jumping the gun, but being able to print out two different handouts that are automatically generated from the tool. One is the take home for the patient with the graphs and the citations underneath. The other is a letter that you just fill in the patient's name and their pediatrician information, and you're sending that to them in a form of doctor to doctor professional communication. But that's marketing. That's letting the pediatrician know, here's how I manage our mutual patient. Here's what we do. Here's how I'm taking care of them. And for those that are on board, great. For those that aren't, we've got the citations underneath for them to reference. Whether they look at them or not is a different story. But it behooves us to, send patient information home with the parents, and we know that in the chart. And then also reach out to the pediatrician, because I don't know about you, we're not good at external marketing, especially within the healthcare community, other than building strong relationships by mutually managing patients, and having a tool that automatically does that is really helpful.
That's one of the things, as you recall, myopia management, when we developed that, it was 2019, and we were launching it in 2020. And so as you and I were working on this, one of the things that, at that time, myopia management had not been widely accepted. And I would say the last 4 years has really ramped up in the acceptance in the medical community. Not just optometry, but even within pediatric ophthalmology of myopia management. At the time, we did not have, the American Academy of Ophthalmology statement on myopia management. So we were planning to have to convince pediatricians that when the parents are talking to the pediatrician about what their optometrist is doing, anticipating that they would be like, well, what is this? No, that's not right. Go talk to this pediatric ophthalmologist down the road. We were anticipating that. So part of that printout is, as you say, being able to say, here's our citations, here's why we're doing what we're doing, here's the LAMP study, here's Atom 1, here's Atom 2, here's why we've made, here's the MySight data, so that we're just removing, and part of that is removing the conservative nature of our profession, of worrying about what's going to happen when the parent gets, talks to the pediatrician. Now, I think for the last 4 years, that's been less of an issue, but it's still probably an issue. So I think your point is really helpful.
Yep, absolutely. And I also think that the pediatrician's not the one seeing that notice. It's the nurse, it's the front desk, it's their staff, who are the ones who communicate with, mom. Usually it's mom that takes kids to the pediatrician, and at least at my household, and the pediatrician says something, but they rely heavily on the follow-up recommendations and communications that their nurses in the front desk and that the rest of their team has, no different than our office. So for them to be able to see that as well in a very digestible format, I think is important.
Yeah, totally agree. So listen, it looks like Aaron, so this is great because Aaron and I are testing out a couple different things. I'm going to wrap this up. If you have not had a chance to listen to Aaron Warner's show, his show releases on this same channel on iCode Media on Wednesdays. Mine is on Mondays. We've incorporated Aaron into the podcast now, and I'm sure you've heard him on there. He does an awesome job. He interviews differently than I interview. He's got insight clearly that's different than mine as well. But we've had him on now at this channel, and he's been a great partner on this channel since July of 2023. And so I kind of went over how we got to our sponsorship, but then I think Aaron is one of the main ways that we've expanded and not just expanded how often we do the podcast, but given another way for people to think about ideas. So if you haven't checked this podcast out, please do. Also, in the links of today's show notes, if you are interested in Vision Source, if you're an independent practice and you kind of qualify for Vision Source and you're an independent doctor, you should check it out. I mean, we're doing pretty awesome things within Vision Source. It's a lot of docs who are like-minded in terms of growth, in terms of integrating new technologies, and really integrating new ways and continuing to push the limits on how we help patients and how we run our businesses. And so we'd love to see you at the exchange. There's a little link in the show notes today where if you're interested, just fill it out. There's no obligation. There's no other, people aren't going to hound you. But if you're interested in coming to the exchange and seeing what it's all about, we'd love to see you there. And with that, we'll see you guys on the next episode. Thanks for jumping on. Thanks, Aaron, for jumping on and testing this out. I appreciate it.
Absolutely. Thanks, Chris.